Hi, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. Sorry that I've been off screen for some time, but it's been very busy here at the Dr. Mom Show home. We had some fun adventures, and I will be updating you with that pretty soon. I'm so excited. I'm working on an uncut episode of our adventures recently, and I think you have a fun time watching it, especially since the Tripsies are involved. It's never dull with them around. Oh, it's been so crazy here. Recently, we had a stomach bug go around. Even mommy and daddy here got affected. So it's been kind of hectic, but I'm so excited to be back on. And I'm doing this tonight again uncut because it's been such a hectic week, but I didn't want to leave everybody hanging for a long time. I thank you for being so supportive and patient with everything, especially juggling everything that goes on here with myself and the family. Well, I'm so excited because tonight I'll talk to you about teething. I get a lot of questions about that. Who doesn't love nice teeth? And everybody gets very excited when their babies start teething. It is a fun time during their babyhood. So first of all, I just like to let you know that teething normally starts anywhere between 4 and 7 months. And when we say teething, that doesn't necessarily mean that there's a tooth coming out right away, that once they're teething in like weeks you'll see a tooth. Teething also involves the inflammation, the swelling, redness of the gums. So a lot of times that's a symptom you'll see first. It's not like the tooth, as we call it, erupts or breaks through the gums automatically, or I should say quickly. So a lot of times babies can be teething for some time before you really see a tooth come through the gums. As far as the sequence of their teeth, normally their front teeth will come out first, and I'll use my teeth as an example. So usually it's either two top teeth or the two bottom front teeth that come out. Normally when babies' teeth, it's symmetric. So if they get their bottom tooth first, if it's the left one, they'll get the right one next. And then they'll get the top teeth, and vice versa. If they get their top teeth first and they get the right one first, then they'll get the left and then they'll get the bottom. After those, what we call central incisors, they usually get molars, and then their canines come out. Approximately at 30 months, about 2.5 years of age, is when their baby teeth are done erupting all the way. And of course there is some variation, but that's most average for that. As far as symptoms that occur, well, everybody's very aware of drooling. Babies at this point, once they start teething, will have saliva all over the clothes. When they don't have a clothes on, it's dripping all over their skin, on their chest, all on your arm. And of course, they love chewing on things, including your fingers. So anything that comes in their field of vision, you better watch out. So if you like your fingers, keep an eye on them when they come close to a baby's mouth who is teething. Now, things that you can do to help include cool items. So the teething rings, you don't want them to be too hard. So the teething rings, you don't want to put them in the freezer. The fridge is just fine. They like that cool sensation. It gives their gums that are swollen some relief. You can also do over-the-counter pain relievers can be helpful. Again, consult your physician or your child's physician regarding this. And then I know parents ask about topical pain relievers. Usually these aren't recommended because a lot of the over-counter medicines have ingredients like benzocaine or lidocaine that can cause respiratory issues in your child if they get too much. And what's tricky with these is a lot of parents will keep putting it on because what happens, because it's topical and rubbed on, it can get washed off if they drink milk or anything like that. And if they become fussy again, parents will start putting more on. and that can affect their breathing because of those ingredients. The FDA does have a warning out, and most recently they're trying to get some of these items off the shelves in the stores. So again, before you use anything on your child, please consult with your physician or your child's physician. Some other symptoms that can occur include fussiness, irritability, your baby being cranky. Sometimes they can have fevers. Normally, they don't get fevers over 101. If they do start having higher fevers, again, the physician should be called because it needs to be figured out if something else is going on, because you don't want to blame it just on teething if something else could be going on causing the fever. A big question I get is about pulling or tugging at the ear. Sometimes we do see this in teething, and this is because the pain in the gums can radiate up to the jaw and to the ear, and babies will pull on their ear. So that doesn't necessarily mean an ear infection, but again, if they're having higher temperatures or you feel that they're acting different than they've acted in the past with teething, just have them checked out. So again, this is not a super fun time, especially if your baby gets really cranky and irritable during teething, but it is a fun time in the sense that you get to see their teeth come out and it's nice to keep track of them. But just enjoy it. It will get better. They will get all of their teeth and they'll have a great smile, even though babies somehow get away with having a cute smile with only gums before they have teeth, but not so much when you're an adult. Well, I hope you really enjoyed this segment. I did, and I really missed talking to you all. And I look forward to future shows. Again, if you have any comments or ideas or topics that you want me to address, please don't hesitate to comment, and we'll try to get that on our future episodes. Again, we look forward to seeing you in the future. Don't forget to subscribe to our Dr. Mom channel, and also don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Thank you. Have a good night. Bye-bye.